All right, welcome back to Always Adaptive. My name is Randall James. I'm a strength and a running coach with 11 years of experience. And today we are talking about ice baths and other forms of cryotherapy. I cannot count how many times I've been asked about ice baths in the past few years. They have exploded on the scene. And while I do think that ice baths can be useful, I think you need to firmly decide what your goal is, because there are contexts in which ice baths are not good. And there are other alternatives that are more accessible and give you some of the same benefits. We'll get into that shortly, but before we do, real quick, if you want more health and fitness information like this, where I deep dive topics in an easy to digest way using personal experience and my own hunger for knowledge, then hit that like and subscribe button. I release a new video every week, and basically this channel is just my way of getting the stuff that I'm researching out of my head and into a creative outlet of sorts. I also do some reaction content, but I've tried not to pigeonhole myself into that style. I don't want to seem like a grifter riding coattails of other big named creators like Mike Israetel. It will happen sometimes though, when people say some dumb things inevitably. Also, if you're over on the audio version, I'd love the chance to earn a 5-star review from you, so stick around. With that out of the way though, on to the video. So I think at the start here, it's important to define the different contexts in which someone might consider an ice bath. The ones that really stick out to me are pain, hypertrophy, and lastly, mental health. You might be scratching your head at that last one, but I promise you there is a large group of people out there touting the mental health benefits of cold therapy. So starting with pain reduction, do ice baths help in this realm? We're going to hit the evidence rapid fire. We have a lot of data to cover here, so these won't be super deep dives. Some studies I will go into a bit more depth, but others, it will just be a short summary. If you want more of a deep dive style into fewer studies and future videos, let me know in the comments. But it is important to try and tackle as much data as possible for a topic that has just so many studies behind it. We shouldn't make decisions based on one study after all. Anyways, first up, cold water immersion for preventing and treating muscle soreness after exercise. This was a Cochrane review from 2012. This review pulled together 17 small trials with about 366 people. Most compared an ice bath to simply resting after hard exercise. Here's the results. At 24 hours, there was a moderate reduction in soreness compared to passive recovery with an effect size of about minus 0.55. That means a moderate effect. At 48 hours, the effect got a little stronger, around minus 0.66, so still in that moderate to borderline large range. By 72 hours, the results were the strongest. The effect size was minus 0.93, which is considered a large reduction in soreness. In plain language, that's a big difference in how sore people felt compared to the controls. At 96 hours, the effect dropped back down, but was still meaningful, about minus 0.58. So again, a moderate reduction. So across the first 4 days after exercise, cold water immersion consistently reduced soreness, with the biggest impact showing up at around 3-day mark. But there's a catch. The results of this study were highly heterogeneous. Heterogeneity means that studies weren't all done in the same way. Different exercise protocols, different control groups, different setups, and that mix can really change how strong the overall results look. For example, crossover trials where the same people tried both conditions tended to show larger effects, and running-based exercise protocols also showed stronger benefits compared to other forms of training. When those results are mixed in with the other studies that didn't have a strong effect, it will make the end results look much better. It can also go in the opposite direction. A few studies with a negative result can make the results of a meta-analysis look worse than they actually are. So yes, there's a clear signal that cold water immersion can help with soreness, in this study at least, but the magnitude of the benefit depends heavily on the context, the type of study, and the kind of exercise being done. Next, a more recent meta-analysis in Physical Therapy in Sport from 2021 titled Heat and Cold Therapy Reduces Pain in Patients with Delayed Onset Muscle Soreness, a systematic review and meta-analysis of 32 randomized control trials. When cold was applied within an hour after exercise, it did help with soreness at the 24-hour mark. The effect size was about minus 0.57, which is a moderate reduction. But after 24 hours, the benefit basically disappeared. Now let's flip to heat. This is where things got interesting. Heat therapy showed stronger and longer lasting effects. Within 24 hours, the reduction in soreness was large, with an effect size of minus 1.17. And unlike cold, the benefits continued. Even after 24 hours, heat still produced a large reduction in pain. And if you zoom in on hot pack specifically, they were the clear winner. Within 24 hours, the effect was massive, minus 2.31. And even after 24 hours, the benefit was still very large at minus 1.78. So the bottom line here is both cold and heat reduced soreness, but overall, heat, especially hot packs, did better and the benefits lasted longer. And while there wasn't a statistically significant difference when people directly compared cold to heat, the signal was pretty clear that heat came out on top. Now, this might seem counterintuitive, and I'm certainly guilty of telling people to ice for pain, not heat. But the nuance is that DOMS isn't the same thing as an acute injury like a sprain or something where you might want to reduce the swelling if it's causing pain. Heat increases blood flow, it relaxes the muscles, and it may speed up clearance of metabolites. For DOMS, you don't actually want to shut that process down. You want the immune system and the lymphatic system to cycle through, clean up, and repair. Heat essentially opens the pipes while cold clamps them down. Next up, we have Selwood et al., 2007, in the British Journal of Sports Medicine. This study was titled Ice Water Immersion and Delayed Onset Muscle Soreness, a randomized controlled trial. The researchers recruited 40 untrained volunteers and had them perform a quadricep workout with their non-dominant leg. After that, participants were randomly assigned to one of two groups. Half were put into the ice water immersion group, doing 3 one-minute immersions at about 41 degrees Fahrenheit. The other half went into the tepid or lukewarm water control group, doing the same protocol but at around 75 degrees Fahrenheit. The researchers measured everything you'd expect: pain and tenderness, swelling using thigh circumference, functional performance with a one-legged hop test, maximal isometric strength, and even serum creatine kinase as a blood marker of muscle damage. They tracked all of these at baseline, then again at 24, 48, and 72 hours after exercise. And here's the result. Across almost every single outcome, pain, tenderness, swelling, strength, hot performance, and creatine kinase, there were no significant differences between the ice group and the control group. Ice baths simply did not improve recovery in any measurable way. But wait, there's more. On one test, during a sit-to-stand movement at 24 hours, the ice group actually did worse. Their pain increased by a median of 8 millimeters on the visual scale compared to just 2 millimeters in the tepid water control group. That difference was statistically significant. Imagine hopping out of an ice bath thinking you're healed, then standing up like, nope, that's a solid 12 out of 10 pain right there. Let me sit my happy ass back down. We've all had those days, the day after a leg day, it's the morning, you're sitting down on the toilet, and you are seriously considering calling somebody for help because you can't get off the toilet. So the conclusion was clear. This specific ice water immersion protocol was ineffective at reducing DOMS markers in untrained individuals. In fact, on at least one functional measure, it actually backfired, making pain worse the next day. Moving on to Glasgow et al. From 2014 in the journal Physical Therapy and Sport, titled Cold Water Immersion in the Management of Delayed Onset Muscle Soreness. Is dose important? A randomized control trial. They randomized 50 healthy participants into 5 conditions: short hot-cold contrast, short intermittent cold, 10 minutes at 50 degrees Fahrenheit, 10 minutes at 43 degrees Fahrenheit, and seated rest. What they found was no statistically significant differences across groups for soreness or the other outcomes. One of the very cold groups had the lowest soreness numerically, but it wasn't significant. In plain English, fiddling with temperature and duration did not reliably change DOMS. Speeding through, next up we have Nasser et al. From 2023 in the journal Frontiers in Physiology, titled Cold Water Immersion After a Soccer Match, Does the Placebo Effect Occur? This was a randomized, counterbalanced crossover study with 12 semi-pro soccer players after a simulated match. They compared cold water immersion for 15 minutes at 52 degrees Fahrenheit, a placebo condition, and rest. The placebo was a beverage provided under the pretense of being a recovery intervention. So these people thought they were drinking a recovery drink. The results were that both the ice bath and the placebo beat rest for next day soreness, and the ice bath wasn't clearly better than placebo. That tells us expectations can play a real role in how sore people feel, and is exactly why it's important to check that a study has a placebo group. Without that group, this study would look like a clear win for the cold therapy group. So yeah, turns out just thinking you're recovering works about as well as actually freezing your butt off. Maybe I should start placebo meal prepping. If I think it's happening, it might actually be happening. So the takeaway is, I think if you're in pain from really hard training and you're kind of at your wit's end, then turning to cold therapy as a last-ditch effort to reduce the pain without having to resort to meds is a good bet if it's easily accessible. But it would not be my first resort, and I certainly would not go out of my way to get a tank and go through all the work necessary to keep it filled and clean. Is the evidence strong enough to warrant an entire ice bath setup on your back deck? No. Not in my opinion. If pain is becoming a chronic issue for you, then I would turn to massage therapy or self-massage with foam rollers and lacrosse balls. Massage has a lot more high-quality evidence backing it up for its effectiveness in reducing pain. So after pain, the big question is, does cold therapy change the way your body builds muscle, aka hypertrophy? Let's take a look. First up, post-exercise cold water immersion attenuates acute anabolic signaling and long-term adaptations in muscle to strength training. Roberts et al. Out of the Journal of Physiology. This research team actually ran 2 separate studies. The first one looked at long-term adaptations over 12 weeks, and the second dug into the short-term cellular responses after a single workout. Together, they give us the full picture, not just what happens at the performance level, but what's actually going on inside the muscle. In the 12-week study, they had 21 physically active men strength trained twice per week. After every session, half the group did 10 minutes of cold water immersion at about 41 degrees Fahrenheit, and the other half did active recovery with light cycling. Here's what happened. Strength and muscle mass increased more in the active recovery group than the cold water group, and the differences were quite significant. Isokinetic work capacity went up by 19% in the active recovery group, but not in the cold water group. Type 2 muscle fiber size also increased by 17% with the active recovery, but again, no change with cold water. And the number of myonuclei per fiber, which is the nucleus of muscle cells, myo means muscle, rose by 26% in the active recovery group, but not in the cold water group. So right away, after 12 weeks, we see that cold water immersion blunted strength and hypertrophy gains compared to just light cycling. Now let's move on to their second study, which zoomed in on the acute response. They took 9 active men and had them do a bout of single leg strength exercise on separate days, followed by either cold water immersion or, once again, active recovery. This time, they collected muscle biopsies before exercise and then 2, 24, and 48 hours after. Here's what they found. In the active recovery condition, satellite cells increased significantly. Satellite cells are like the repair crew for your muscles. They hang out on the outside of your muscle fibers until a training stress wakes them up. When they activate, they fuse with the muscle to repair damage and add extra nuclei, which gives the muscle more capacity to grow. The NCAM positive cells, that's one marker researchers use to track satellite cell activation, went up by about 10 to 30%. And the PAX7 positive cells, another marker showing those repair and growth cells turning on, jumped even higher, around 20 to 50% within 24 to 48 hours. But in the cold water condition, the story was very different. NCAM positive cells really didn't budge until 48 hours later, and even then, the change was much smaller. Across the board, both NCAM and PAX7 counts were significantly higher after active recovery than after cold water, which shows cold immersion was dampening the normal muscle repair response. They also measured anabolic signaling through phosphorylation of P70S6 kinase. It increased after exercise in both groups, but the rise was greater with active recovery than with cold water. So when you put these 2 studies together, the story is pretty clear. Cold water immersion not only blunted long-term strength and hypertrophy gains, but it also suppressed the short-term cellular responses and anabolic signals that normally drive muscle growth. The authors concluded that if you're doing resistance training and chasing hypertrophy, the regular use of cold water immersion as a recovery tool should really be reconsidered. Next, cold water immersion attenuates anabolic signaling and skeletal muscle fiber hypertrophy, but not strength gain. Following whole body resistance training, Fife et al., Journal of Applied Physiology. This trial recruited 16 men, average age about 23 years old, who trained 3 days per week for 7 weeks. After each workout, they were randomly assigned to one of 2 groups. One group did 15 minutes of cold water immersion at about 50 degrees Fahrenheit, and the other group did 15 minutes of passive recovery in room temperature water about 73 degrees Fahrenheit. Here's what they found. Both groups got stronger. On the 1 rep max leg press, gains were almost identical, about plus 130 kilograms in both groups. So strength improvements were the same whether cold water was used or not. But when they looked at muscle growth, the story flipped. In the passive recovery group, type 2 muscle fiber cross-sectional area increased as expected. In the cold water group, it was actually blunted with an average reduction of about 1,900 micrometers. That's a large difference in hypertrophy. The muscle biopsies explained why. Anabolic signaling through the mTOR complex 1 pathway was suppressed in the cold group. It was down about 0.4-fold at 1 hour and 0.2-fold at 48 hours after training. At the same time, markers of protein breakdown like FOX1 protein content increased by about 1.3-fold with cold. And the normal training-induced rise in heat shock proteins was reduced as well. So here's the bottom line. Cold water immersion after lifting did not stop people from getting stronger, but it significantly reduced muscle fiber growth and the cellular signals that drive hypertrophy. Hypertrophy. The last study was titled, Does Regular Post-Exercise Cold Application Attenuate Trained Muscle Adaptation? This one used a single joint model. 14 men did wrist flexor training 3 times a week for 6 weeks. One arm was treated post-session with forearm immersion, 20 minutes at around 50 degrees Fahrenheit. The other arm served as a non-cooled control. The results? Muscle thickness increased in both, but the increase was significantly smaller in the cooled arm. Strength and brachial artery diameter improved in the non-cooled arm, not in the cooled arm. Even in a small muscle group, regular post-exercise cooling dampened hypertrophy. So look, if your goal is building muscle, making ice baths a routine right after lifting is not your friend. Across multiple randomized trials, regular post-lift cold attenuates hypertrophy with mixed effects on strength depending on the study length and outcomes. Save the hard cold for competition windows or off days, not immediately after your hypertrophy sessions. So with me, I know this has been a lot. We got one more category to go through. The last one I wanted to look into was mental health benefits. This is a big one because I feel like this is what sort of got cold therapy on the map. Wim Hof getting on Joe Rogan and talking about the benefits. But is there actually any evidence that it improves mental health? Let's find out. First up, a 2024 trial titled A Randomized Control Clinical Trial of Wim Hof Method Intervention in Women with High Depressive Symptoms. Researchers took 84 midlife women who were under high stress and experiencing significant depressive symptoms. They split them into 2 groups. One group followed the Wim Hof method, which combined a breathing technique designed to create intermittent low oxygen states along with daily cold showers. I actually used to use the Wim Hof method every morning without the cold, of course. I would just do the breathing exercises, and I do think that they were a great way to start my day. The other group was the active control. They practiced slow-paced breathing paired with warm showers. Both groups followed 15 minutes of guided audio every day for 3 weeks, right in the middle of the COVID-19 pandemic. The results? Both groups improved their mental health in very similar ways. Depressive symptoms dropped by about 24%, anxiety dropped by 27%, and perceived stress fell by 20%, and those improvements actually lasted. At the 3-month follow-up, nearly half of the women were reporting only mild or no depressive symptoms at all. Where the Wim Hof method actually stood out was in reducing rumination. Rumination is like that mental loop where you replay stressful events in your head over and over and over again, and you just cannot let them go. Women in the Wim Hof group showed significantly greater reductions in rumination after stressful events compared to the warm shower control group. Both groups also saw reduced daily negative mood during the intervention, and both groups showed a healthier biological stress response. After the program, their peak cortisol reactivity to a lab stress test was lower, which means their bodies were not spiking stress hormones as strongly as before. So the big picture here is this. Cold showers did not outperform warm showers when it came to depression, anxiety, or perceived stress. But when it came to breaking out of those repetitive thought loops, that's where the Wim Hof method offered a unique advantage. And is that actually due to the cold, or was it the breathing? The fact that the control group that was doing slow breathing also saw benefits, to me, speaks to the power of breath work, not cold therapy. Next up, an RCT in Nature titled The Effectiveness of the Wim Hof Method on Cardiac Autonomic Function, Blood Pressure, Arterial Compliance, and Different Psychological Parameters. 42 participants were randomized into 2 groups. The intervention group practiced the Wim Hof method every day for 15 days, while the control group did nothing. Before and after the intervention, the researchers measured things like blood pressure, heart rate, arterial stiffness, and heart rate variability. They also looked at psychological outcomes such as perceived stress, mood, and vitality. On top of that, they ran a cold pressor test where participants immerse a hand in ice water to see how the body reacts under cold stress. And here's what they found. Across the board, there were no significant differences between the Wim Hof group and the control group. Heart rate, blood pressure, arterial stiffness, heart rate variability, perceived stress, mood, and vitality, none of them improved, even in the cold pressor test. There were no differences in cardiovascular responses or in how much pain the participants felt. But it is important to note, this was a short study, just 15 days long. The fact that there were no measurable benefits in 2 weeks does not mean that longer-term practice would not help. It simply means that in the short term, the Wim Hof method did not produce the kind of cardiovascular or mood benefits that people might talk about. So the takeaway here is, in a 2-week trial, daily Wim Hof practice did not change cardiovascular or psychological markers. But whether a longer, more consistent practice could make a difference is still an open question. Finally, a 2020 double-blind trial in Frontiers in Psychiatry looked at whole-body cryotherapy standing in air at minus 110 to minus 160 degrees Celsius as an add-on to antidepressants. Now, you're probably like, hold the F on, Randall. Minus 110 to minus 160? Yes, you have to remember that cold air is different than cold water. They're able to play around with much colder exposures when it's air. Anyways, here we do see bigger drops in depression scores and better mood or quality of life versus sham, where they were also on antidepressants and stood in the same chamber just with air that wasn't as cold. This study was on a different modality than ice baths or showers, but it shows cold exposure can augment treatment in depression. For everyday water-based cold in healthy or stressed adults, unique mental health gains beyond good breathing or warm water controls are not consistent yet. But in clinical depression, cryotherapy as an add-on shows a little bit of promise. So let's land this plane, shall we? This has been a long one. Get to the point, Randall, would you? Sheesh! I think the question people need to ask themselves is, what is my goal? If your goal is to build muscle, I would stay very far away from cold therapy, or at least be extremely strategic about when you used it. I would definitely make sure there was not a hypertrophy session 2 days prior to using cold therapy. The word inflammation almost has like this boogeyman connotation to it. Ooh, the dreaded inflammation. But in the context of hypertrophy, inflammation is actually a good thing. When you do a bicep curl and you get that coveted pump or the swelling in your bicep, that is inflammation. That inflammation is good. That's blood, nutrients, immune cells, proteins, all kinds of good stuff going to that muscle to kick off the hypertrophy cascade. If you use cold to get rid of that, you're essentially interrupting that event as evidenced by the studies that I cited. If your goal is pain reduction for things like DOMS, the evidence is mixed here. I think what's important to understand whenever we have mixed results is that this is where individual experimentation comes into play. When researchers conduct a study, and let's say that it has a neutral effect, that means there were individuals that had a negative effect. But it also means that there were individuals that had a positive effect. Try things for yourself, especially when it's a relatively benign option like cold therapy. And if your goal is mental health benefits, again, the evidence is mixed. There are a lot of people that say they feel better after cold therapy, but does that actually lead to long-term improvements in well-being? I don't know. What I do know is that cold therapy increases your dopamine by a large margin. So those short-term mood boosts are real. The question is whether that translates into lasting changes, and the science just isn't there yet. And that's not necessarily a bad thing, by the way. Sometimes a short-term boost is exactly what you need. But it's important to separate what's a temporary mood lift from what actually changes your long-term resilience, stress response, or symptoms of anxiety and depression. People also say things about starting the day off with something difficult so that everything else downstream for that is easy. I totally get that, and I think that's a useful trick to use. I get that from exercise, especially my runs. Starting off with a 10-mile run or a hard lifting session ensures that everything else after the fact is easy peasy. I think the most important takeaway that I thought about while researching this video was that most people probably would like to have more muscle on their frame. Whether it's for aesthetic reasons or if it's a 60-year-old trying to fight off sarcopenia, I have yet to encounter a client that's like, wait, coach, stop. We need to stop lifting. I don't want to grow my muscles anymore. And so with that in mind, I would just stay away from ice baths and perhaps instead consider contrast showers where the cold isn't so cold that it's going to completely destroy the hypertrophic response. But look, at the end of the day, you can do whatever you want to do. I'm not here to tell you not to. This was just a topic that has been in my head for a while, and I've spoken to a lot of clients about it and figured it was time to actually take a look at what the evidence truly says about it. And that's basically what this channel is. Questions I encounter with clients, topics that intrigue me, whatever it is, if I'm going to form an opinion on it, I want to be backed up with evidence. I don't like to just regurgitate the same things that all of the other fitness influencers regurgitate all the time. But that's it for me. If you found this video useful or you learned something, make sure you hit the like and subscribe button. And if there's a topic you want me to cover, make sure you say so in the comments down below. My name is Randall James, and this is Always Adaptive, a business born from the idea that you are always adapting. Literally, right this moment, whether you're sitting or you're standing, that is an input. Your body is adapting to that. So control your inputs, and you can control your life. Thank you so much for watching. I'll see you at the next one. Stay adaptive.